Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Understanding consciousness. The Glasgow Coma Scale. Imagine a patient rushed to the emergency room, unconscious after a car accident. How do doctors quickly assess their brain function? This is where the Glasgow Coma Scale, or GCS, comes in. Developed in 1974, the GCS is a simple, universally recognized tool that assesses the level of consciousness in a patient with a suspected brain injury. Think of it like a measuring stick for awareness. Instead of measuring length, it measures how well the brain responds to stimuli. This helps doctors understand the severity of the injury and guide treatment decisions. The beauty of the GCS lies in its simplicity. It uses 3 easily observable parameters: eye-opening, verbal response, and motor response. Each of these parameters is scored individually, and the scores are then combined to produce a final score that ranges from 3, indicating deep coma, to 15, indicating fully awake and alert. This standardized scoring system allows for clear communication among healthcare professionals and helps track a patient's progress over time. Decoding the responses, eyes, voice, and movement. Let's break down the 3 components of the GCS. First, we have the eye-opening response. This assesses how the patient's eyes react to different stimuli. Do they open spontaneously? Do they open to sound or touch? Or are they completely unresponsive? Next, we look at the verbal response. This evaluates the patient's ability to speak and communicate. Can they answer questions coherently? Are they confused or disoriented? Do they only moan or make incomprehensible sounds? Finally, we assess the motor response, which examines the patient's ability to move their limbs on command. Can they follow instructions like squeeze my hand or lift your leg? Do they withdraw from painful stimuli? Or are their movements abnormal and uncontrolled? Scoring the scale examples and interpretations. Each component of the GCS is scored on a scale, with higher scores indicating better neurological function. Let's look at some examples. For eye-opening, a patient who opens their eyes spontaneously scores 4 points, while a patient who doesn't open their eyes at all scores 1 point. For verbal response, a patient who can converse normally scores 5 points, whereas a patient who only moans in response to pain scores 2 points. For motor response, a patient who can obey commands scores 6 points, while a patient who exhibits abnormal flexion to pain scores 3 points. These scores are not just arbitrary numbers. They provide crucial information about the patient's neurological status. For instance, a low score in verbal response might indicate damage to the language centers of the brain, while a low score in motor response could suggest a spinal cord injury. Section 4. The bigger picture, total score, and patient outcomes. Once we have individual scores for eye-opening, verbal response, and motor response, we add them to get the total GCS score. This score provides a general overview of the patient's level of consciousness and helps predict their prognosis. A GCS score of 13 to 15 usually indicates a mild brain injury. These patients are typically awake and alert, though they may have some confusion or memory problems. A score of 9 to 12 suggests a moderate brain injury. These patients may be drowsy or confused and require close monitoring. A score of 8 or less is considered a severe brain injury. These patients are often unconscious and require intensive care and life support. It's important to remember that the GCS score is just one piece of the puzzle. Section 5. Beyond the scale. A glimpse into neurological examination. While the GCS is a valuable tool, it's just the tip of the iceberg when it comes to assessing a patient with a potential brain injury. A comprehensive neurological examination involves a series of tests that evaluate various aspects of the nervous system. This includes checking the patient's pupils for size and reactivity to light, assessing their cranial nerve function, evaluating their muscle strength and reflexes, and observing their gait and coordination. These assessments provide a more detailed picture of the patient's neurological status and help identify specific areas of the brain or spinal cord that may be affected. Remember, early detection and intervention are crucial for improving outcomes in patients with neurological injuries. UMCC. Your ultimate medical consultant connector.